My name is Marie Peterson. I am the Regional Partnership Manager for Polk County. Thank you for coming to a discussion about senior hunger today. Just a few items that I wanted to address. There will be room for questions at the end of the session, so we'll save time for that. Session is being recorded, and another plug to complete your surveys. Now I'm happy to introduce our speaker, moderator, Bambi Press. Bambi is the Healthy Aging Director for the Iowa Department of Aging and Nutrition and Aging Resource Center. Bambi supports the Aging Network and the delivery of Older Americans Act congregate and home-delivered nutrition services, including new innovative service delivery models that are changing the senior nutrition program landscape. She previously served as Community Nutrition Director for a home-delivered nutrition program in Central Iowa. Bambi is a registered licensed dietitian who is committed to helping people enjoy a better quality of life through improved access to good nutrition. Please help me welcome our moderator, Bambi Press.
Wonderful. Thank you so much. We're so excited to be here today, and thank you to the Food Bank of Iowa for extending the invitation to the Iowa Department on Aging and the Nutrition and Aging Resource Center, which are actually two different things. I'll explain that in just a minute. And also, we're happy to have a panel here today and hoping to just kind of have a discussion about kind of how we can better reach more older adults. I think you'll hopefully hear some new ideas, and we're looking forward to hearing what you have to share today, too. So we will be using Mentimeter for today's presentation. So I invite you now to get your phones out and scan the QR code that you'll see on the screen here. And we'll use this to kind of communicate back and forth in sort of a quick way. We only have an hour here today. And when the time comes, I'll walk you through how to use it. But you should see if you're able to access that QR code, or you can just go to menti.com and enter the number that you see on the screen. This is how we'll communicate back and forth during today's discussion. Yeah. Okay, so we'll all get to learn something new today because, full disclosure, this is my first time doing a presentation this way too. Okay. Everybody set? Yes, no, maybe? Okay, perfect. So I'll start with just a little bit of background on the Iowa Department on Aging, but I don't want to dwell on this too long. Just kind of explain that the area agencies on aging and the Iowa Department on Aging partner to provide really a suite of core services to support older adults in healthy aging. Our conversations with our food bank partners and our food pantry partners tend to center around that middle bullet, nutrition and health promotion services. But I'll also mention that the area agencies on aging and the Iowa Department on Aging, through the Older Americans Act, are charged with two other types of service. So information and assistance, which would involve things like options counseling when a person is evaluating their options to age at home, services to promote independence, so connecting people with the services so that they can do that in a really healthy way. And I thought it might be helpful also to share with you kind of what those planning and service area sort of regions look like. We have 6 area agencies on aging that provide these services across the state. And in some cases, those area agencies on aging align really well with the service areas that are covered by our food bank partners, and certainly, almost all of them touch the Food Bank of Iowa planning and service area. So that brings us to our first question, which is, does your agency collaborate with your local area agency on aging? I think we'd love to get a sense of whether those partnerships are already, because we know there's some really strong partnerships already across the state. Perfect. So a little mixed, most of us yes. So hopefully if you don't yet, after today, you will. And certainly if you need any help doing that, I'm here to help. Perfect, thank you. The nice thing about Mentimeter, if you're not already familiar, is that it'll capture the responses to today's questions. It doesn't necessarily capture who said what, but if you're interested in seeing the results after today's presentation, my contact information will be available, and I'm happy to share those with you. Okay, so back to the nutrition program. I'd like to start with the purpose of the Older Americans Act nutrition program. Most of our panelists today are really heavily involved in the administration of these services. And really, the core purposes of these services are to, similar to the work that you do, reduce hunger, food insecurity, and malnutrition, but also to promote socialization and promote the health and well-being of older people. There are definitely some differences between food pantries and Older Americans Act nutrition services in terms of how we go about delivering services. So, reducing hunger certainly is at the heart of these nutrition programs and what they do, but there are these other components as well. Older Americans Act nutrition services are not means-tested services. They're voluntary contribution-based. And so that's something that we always like to point out because it is a pretty significant difference. So I also wanted to share a little bit of information specifically about what's happening with the older adult food insecurity landscape. You may or may not already be aware that there are certain groups of older adults who tend to experience higher rates of food insecurity, and those are detailed on the slide here. I won't read them to you, but one group that I really want to point out is those ages 60 to 69. And since Feeding America has started measuring older adult hunger, this group has always been at the highest risk of food insecurity. The other thing, though, that I want to point out is in the latest Feeding America report on senior hunger for 2021, the one that just came out in April, they also pointed out that there was a really sharp increase in food insecurity and very low food security among those 80 and over. So if you look at the graphic here, those age 60 to 69 are represented by the blue line at the top, 70 to 79 are the red line, and 80 and over are represented by this green line. And so for the first time since this data point has been measured, those 80 and over overtook those 70 to 79. So certainly that's something I think for this network to be aware of and pay attention to. And then of course looking at the data in that report and how it's almost certainly at least a little bit skewed by the expansion of food assistance programs over the last few years. Some other factors that I'd like to point out are the increased risk of food insecurity among those living alone. So this was another area where we saw a really significant increase just from 2020 to 2021. The food insecurity prevalence among older adults who are living alone increased in a really significant way, and more so than we saw in other groups. So also something to be aware of, and I'm happy to share this data afterwards. So this slide really just kind of walks through some of those differences between Older Americans Act nutrition programs and USDA programs. As I mentioned, the OAA nutrition programs, the Older Americans Act actually prohibits means testing and instead encourages our area agencies on aging to target services to specific groups. So certainly those who are living on lower incomes, those who are part of minority communities, those who may have a lower English proficiency, those who are at risk for institutionalization, those individuals are targeted by these programs. But really the only eligibility criteria is being 60 and over. That's it. Or the spouse of someone 60 and over. And that alone determines eligibility for OAA programs. So in that way, it's very different from the services that you provide. So I'm going to switch gears just a little bit as we prepare to introduce our panel. And I would like to ask you, what is your biggest barrier in reaching more older adults? Because I think we certainly want to hear that and make sure that we can get to that conversation today. So you may have to refresh if you're on menti.com. you may see a button at the top that says the presenter has changed the slide, and if you do, hit that little blue button, and that'll bring you here. Oh, it's not showing me my results. All right, just shout them out. Oh, are they up there? Oh, good. Okay. Like I said, it's my first time to use the phone thing. So transportation, I see language, letting people know about services, more transportation, certainly. That's a huge barrier across the board. Yeah, people actually seeking out help, that sort of reluctance, I think, that we see. Disseminating information, internet, certainly. So I'll also share, a few years ago, the Iowa Department on Aging conducted a study of congregate nutrition services, because despite everything we know about the increasing need for these services, we actually saw about a 60% decline in participation over the course of about 10 years. And through that study, we identified 6 major barriers, and some of them I think are pretty similar to some of what you all mentioned. Granted, this was a study done of people who were generally participating in congregate nutrition services at some point, and so transportation isn't specifically spelled out, but is part of, I think, this environment component. But we looked at the nutrition guidelines themselves, the menu, the environment where meals were served. Funding certainly is always an issue. The registration process itself, I think some of you kind of alluded to that with, people just not wanting to go through that process. And then marketing, that one's huge. The marketing of the services and, how we go about connecting people and, really helping people see that they belong here and they deserve to have these services. So, in an effort to address all 6 of those barriers, we developed an innovative project called the Iowa Cafe, which is a partnership between area agencies on aging and licensed food service establishments. So these are restaurants, grocery stores. I see some cards. Yeah, so eligible individuals can simply take like a keychain type card or a credit card into a restaurant and enjoy one of their favorite meals with whoever they want to eat with, at a time that works for them, and a place where they want to be, in a community inclusive kind of environment. And so they don't have to, they're not limited to going to have a meal in a church basement at 11:15 on Tuesday, right? You can enjoy breakfast meals, you can enjoy evening or weekend meals, and enjoy those with friends and family who might not otherwise attend a meal at a community center. And so this has been a really effective way to increase reach. And in fact, Iowa's area agencies on aging, through this innovation, are reaching about twice the number of older adults that we were prior to the pandemic. And so, as we kind of have today's conversation, I encourage you to think about what if as we ask some of these questions. So that brings me to our panel discussion. And I'm excited to introduce our panelists today. First, we have Joy Ihle, who serves as the Deputy Director for Polk County Community, Family, and Youth Services. Joy has worked in public service for the past 25 years in Polk County, helping to provide services to some of the most vulnerable individuals in our community. She began her career in youth services, working in both shelter and the Polk County Juvenile Detention Center. She joined the community side of the department in 2013? Thank you. As the program administrator for senior services, the Child and Adult Care Food Program, and Crisis and Advocacy Services. In 2020, Joy accepted her current position and interacts with the food system in Polk County with many different entry points. When not at work, Joy spends time with her family, enjoys being outside, her dogs, and the occasional ride on her own Harley Davidson. Thanks for being here, Joy. Next, we have Heather Stuyvesant. Heather serves as the Director of Community Nutrition for WesleyLife Meals on Wheels, which I'm very familiar with. Heather is an enthusiastic, mission-driven leader with 15 years of nonprofit leadership experience serving marginalized populations. She directs the Meals on Wheels program in Central Iowa impacting food security and social isolation through the delivery of 1,000 hot, delicious, and healthy meals a day to older adults and military veterans. In 2022, Heather and her team delivered over 223,000 meals to 1,600 clients. Heather lives in Des Moines with her husband Jason and 3 children, Noah, River, and Sage. When Heather's not at work, you can find her teaching yoga, listening to live music, and spending time with her family. And last but not least, I'd like to introduce Kyra Hawley. Kyra works with the Iowa Department on Aging as our Employment Initiatives and Livable Homes Director. Kyra Hawley is an experienced aging and workforce development professional who partners with communities and businesses to expand their reach through my apologies, my eyes are not working today, through the training, policy development, and employment of job seekers. As state director of the no, that doesn't make it bigger. I thought maybe it would. I don't have my readers with me today. As state director of the largest federally funded program for older adults who seek employment and training assistance, as well as civic engagement, Kyra has provided oversight and support to state and national grantee partners in Iowa. Kyra has also worked as a vocational counselor and as a community health worker. Kyra serves on the Iowa Mental Health Planning Council as secretary, a representative on Iowa State Workforce Board, State Disability Access Committee, Livable Homes Coalition, Iowa Transportation Coordination Council, OCIO, Digital Equity Core Planning Team, and the Iowa Coalition for Integration and Employment. Kyra earned her BA in Biology and Chemistry Marketing at the University of Northern Iowa and a Master's in Arts in Rehabilitation Counseling at Drake University. Kyra resides in Des Moines and is inspired daily by her fiance and family. Thanks for suffering through that with me. Okay, so in a word, describe the experience for a person accessing food assistance.
It's scary. It's
Mm-hmm.
what you expect. It's scary for them. It's stressful. It's scary.
Embarrassment. I heard scary. I heard embarrassment. Humbled. I see some answers showing up in Mentimeter too. Grateful. Nerve-wracking, ashamed, reluctant. Embarrassing shows up again and again. So those answers that are appearing multiple times will get a little bit bigger. So certainly we want to use today's conversation to find some ways to help people overcome some of those negative pieces. Okay, so I'd like to start with a conversation about the S word. Maybe not the S word that you're thinking of right now, but the S word I'm thinking of is stigma. And so I would invite our panel to talk a little bit about some ways that you in your programs have worked to overcome stigma. Joy, would you like to start?
So we tried to be very intentional in Polk County with where we have located our food pantries to especially address the needs of older adults. So we have 2 Polk County food pantries. One of them is in the same building as our supplemental foods program. In fact, they share a wall and an entry point. So it would be all older adults who might be accessing supplemental foods, and then right next door would be the food pantry, and they could have the same staff member help them through both programs and welcome them, kind of do, or even do a warm handoff. Our second food pantry was built within our Northside Community Center, which has programming for older adults from 8 to 5, Monday through Friday. So again, making sure that the pantry itself was accessible and felt familiar. I sometimes think that having people that they interact with daily also accessing those same services makes things feel easier. And really inviting those people into those spaces, even if they had not indicated that was their first intention. So making announcements at our senior centers about how to use our pantries or supplemental foods, any of our food service programs. And then also saying if you have somebody here that you're sitting with at a senior center, maybe they would want to come with you. Sometimes doing something with someone else makes it less scary, less embarrassing, less intimidating, and really making it an experience where people have choice. So I think those things have been intentional strategies we have used to really engage people and try to limit that stigma.
Yeah, thank you very much. And then I think WesleyLife has also done some things to kind of, change the narrative around some of this. Would you like to share some of that, Heather?
Sure. So at WesleyLife Meals on Wheels, I think we're a little bit different compared to many other Meals on Wheels programs across the state, our nation, that we actually offer choice. So every day, our clients have a choice between 2 hot meals, and then we have a deli option for the entire week. So we offer choice, and I think that also helps put them into able to make their own decisions on what it is that they are consuming, and we want them to consume the food, right? Because it's going to be responsible for about 1/3 of their nutrition, and so we want people to enjoy the food and actually eat the food. So having that choice has really, I think, helped in some ways. We also have noticed that sometimes our clients, we know that social isolation among our population is very high. And so it's really important to have a companion, and a lot of our clients have pets. And one thing that we have started a while ago was a partnership with the Pet Project of Iowa. And what we were finding was that some of our clients, they don't want to say that they need extra help, and they were sharing their food, their meals with their pets. And so to kind of offset that, we partnered with the Pet Project of Iowa, and they donate all of their pet food to us, or 90% of it, so that when we do make deliveries on Wednesdays to individuals with dogs, cats, I think we got a bird, a hamster now too, and we do make those deliveries once a week so that their pets are also taken care of and that the nutrition is going to them. And so I think that is another way that we've kind of worked to maybe offset some of the stigma, that they might be needing more help. And so the other thing that we train all of our drivers, whether they're paid drivers or volunteers, we have a mix of both, to perform those wellness checks so that we can identify when maybe there are some extra help that is needed. Internally at WesleyLife, we do provide home health services and environmental cares as well that people can there's some funding for. So when we recognize these needs, we try to make those connections for them, just to make the process easier so that maybe they don't feel like they have to step up and ask for those help. And, we notice with this generation especially, there's a lot of pride and people don't want to feel like they're taking handouts. And so trying to also empower them with a suggested contribution for the meals that they receive, I think gives them a sense of pride and that they're able to give back what they can in terms of what the food costs and the delivery. So there's just a couple ways that we have worked to kind of end this stigma with our clients.
Wonderful, thank you. So as we kind of start this conversation about changing the narrative, some of it is about what's in a name, right? I mean, we hear more and more from food assistance organizations across the board that we're doing some rebranding and changing the name in order to kind of improve that sense of belonging and that sense of welcoming. So I'm curious to hear whether your agency has rebranded or changed your name to improve that reach, or if maybe you're thinking about it. That's an option here too. So maybe not as much of that happening here just yet. I see an other. I'm curious if you're other, are you interested in sharing why you chose that answer?
We're two nonprofits merging, so we had to pick a name.
So maybe a name TBD in some cases? No, that's okay. That's okay. But yeah, we see lots of creativity, I think, around this across the network. And so it may just be something to think about, because when we're talking about how to reach more older adults, we find that with very few exceptions, it's just like reaching everybody else. Older adults bring some special things into the equation, which we'll get to in just a moment. But, for the most part, those strategies are going to be very similar. So as we talk about what's in a name, I'd love to hear from our panelists again a little bit about how you've used this. How does your organization really kind of consider the needs and preferences of those you serve in the language that you use about the services that your organization provides? Go for it.
This is challenging to start this part of the conversation because a lot of the services that Polk County has provided, we've provided for a long time. I think one thing that we are intentional about with language is introducing things as options and not as a service. So as we try to engage more people in senior centers and community centers, letting them know that during that day, there is food. We do serve a lunch, and but there are other services there. There are other options. I just went backwards on myself, sorry. There are other options there that day. So would you like to participate in a class? Would you like to sign up to do exercise? Would you want to participate in a current events discussion? Do you want to take a class on how to use your cell phone? And so engaging people in activities that surround basic needs, I think makes it seem and feel different. I think when people are feeling good in a space, they are more likely to share it with others. They're more likely to go back and tell someone at church or their next door neighbor or their sister or a friend, hey, this is what I did at the senior center today, and it's a positive. It's not something they're ashamed of, and that's part of the last question about stigma. We are also intentional about trying to make things as comfortable for older adults as possible. So we do have some transportation available, but also then looking at the physical space, physical chairs, tables, restrooms, and to make sure that everything is accessible, and so people can come in and participate with as little distress as possible.
Wonderful, thank you. I think, so as we have this conversation about food insecurity and remembering that it's those in that age 60 to 69 age group who tend to be the most vulnerable, and remembering that those are the older adults who, in a lot more cases, are still working, I'm also curious to hear from Kyra kind of what this looks like in the employment space.
Sure. In terms of, I guess, related to kind of like how you phrase and how you advertise and how you market materials, it kind of depends, right, on how you are, who you're trying to reach, what populations you're trying to kind of target. We use a lot of different, trying to use specific, program requirements. Like for our programs, if you're 55 and older, you can access our programs. So that can be different than like some of the older American Act services or some of the different programs that you might be offering. So we try to be really specific in listing those requirements with our employment services, since those are different than some of the employment services offered at like the Workforce Development Center. So we try to list those services and be specific. We use mature workforce, and that might be some language that you can offer as well. I know sometimes, at least with our clients, it's difficult sometimes to get people to identify as an older adult, and so making sure they feel welcome in those spaces is just really important, and I think that was really what Joy was really referring to.
Thank you.
Here it is. At WesleyLife, we are a lot more than just the Meals on Wheels. We also provide just we serve individuals wherever they call home, older adults wherever they call home, and we're very intentional as an organization about what kind of language we use there as well. So again, we don't really usually refer to seniors as seniors. We refer to them as older adults. Even internally, it's team members versus staff or employee. Our communities across the state, we call them communities for healthy living rather than a senior living community. So those are some of the ways that we ensure that we are using a language that feels safe, and so I think that language definitely does go a long way with creating a sense of safety for individuals. So that's just one way that we do that.
Yeah, I heard in the last session the term neighbors, and I think that's really great. So thinking about how we describe these services, and instead calling it the shop or the neighborhood market or some, a small change like that sometimes can make services feel a little more accessible, a little more appealing, and really kind of create that sense of belonging. So we'll shift gears just a little bit and focus more on older adults specifically. So is there something that your agency has already done to be more age inclusive and encourage more older adults to take advantage of food resources? Well, and I love the way you point out, even sometimes when it seems like we're doing things on a small scale, remembering that those 4 or 5 boxes meant everything, right, to the 4 or 5 people who got them.
WesleyLife, one thing that we recently did too is we noticed a lot of the clients that we serve obviously are homebound and isolated, and so we actually have our own little pantry that we've created with the help of volunteers and donations we've received from some local churches, so that when a driver can identify, this person needs some extra food, they can go in, grab what they need, no questions asked. Same with toiletries, personal care products, because we know that that's probably something that's getting neglected as well when you're trying to decide where your money is going month after month. And so no questions asked. Our drivers go in, get what they need for our clients, and that's something that we're trying to keep maintain that little pantry internally so that we can access or we can provide more access to food. And then when we ever have any meals that come back to our office at the end of the day that maybe somebody wasn't home or they had whatever it may be, they end up in the hospital. We have a number of meals that come back. We stick them in the freezer and we donate those back to DMARC for their mobile food pantries, because we know that a lot of the individuals that they serve with those mobile food pantries are our clients. They want something they can just quickly heat up because maybe they can't, it's not safe for them to cook, or it's too much, they don't have the dexterity or the ability to do so. And so this provides a nice meal that they can just stick in the microwave real quick, and it's a full, complete meal. So, and then that's helped us also be able to maybe access people that we wouldn't necessarily be able to access by putting on a little sticker saying, give us a call if you want to get signed up. So that's just one other way we've kind of tried to reduce the stigma and be more age inclusive.
And I'm seeing lots of comments about delivery and sort of a sense of hospitality around how services are delivered that, I think our panel today has also touched on. So that's really wonderful to see. I'm curious to hear more from Kyra, too, on what this looks like in that employment space.
I just want to comment too for the gal in the back. It's really great as well because you're such a trusted person, is what you really told me in your community. And so we're doing, we have a partnership going on with the University of Iowa to do a project called Age Inclusive Management Strategies, and we're partnering with employers to support their work in developing strategies and do self-assessments in this work. And one of the things is, identifying trusted folks in their networks, in their offices, and supporting, just those grassroots initiatives, just like the one you mentioned. So I just want to point out things like what Heather mentioned, things like what you mentioned are exactly the things that really support those folks that maybe might get left out or left behind in those vulnerable situations. And so other things, just like what Joy mentioned, thinking about ergonomics, thinking about accessibility, those are things that we can look at. So those are things that people have looked at as well. Things you might consider as well are things like your websites, making sure that the photos that you're including include everyone, things like that, or the materials that you're putting out include images of everyone, surveying employees, surveying your clients or customers or your participants or whoever that might include, looking at caregiver resources, things like that, things that you can do. We also talk a lot with employers about, retirement and succession planning and things like that, providing a lot of resources around, what we can do to look at those job descriptions and things like that. So we've been doing a lot of work around creating a more inclusive and flexible culture, and how we can support individuals within the workplace and within places where people come to volunteer, to get services, and I hope that helps explain.
Yeah, thank you. I think that is really helpful. Thank you for pointing that out. Hopefully some things that, some new ideas to take back after today's conference. Any other comments from the panel?
I would say one of the things that we find particularly notable at our congregate meal sites and community centers is quite often as humans, when we interact with each other, one of the very first questions we would ask or talk about is, what do you do? And we identify with that job for such a vast portion of our lives. And then people retire. And I think sometimes they feel, not everybody gets to feel that sense of relief or has grand plans. And the ability for people to give back and have a job has become very important to a lot of the people who attend our senior centers and volunteer in our food pantries. They take an immense amount of pride in being able to be there to help serve somebody else food. They may be getting food themselves, but they enjoy the act of giving back, the act of being able to help somebody else. And that is fulfilling and sustaining in just a different way than the nutrition is. But involving people in those things, I think, is very important.
Yeah, I mean, that's huge. People are more than just their needs, right? And older adults especially, I think, have so much to contribute. And so looking for those opportunities is really helpful. You know, even when we look at some of those barriers, where are there some opportunities to put people to work? And if transportation is a barrier, can we partner between, food pantries and Older Americans Act nutrition programs, to leverage our volunteers, who we know are unfortunately kind of scarce right now. And, is there some opportunity to make better use of what we do have and those resources that we do have? Could someone who's delivering a home-delivered meal, also take a delivery from the food pantry, so you're not having to arrange a separate delivery?
I guess I could also mention, for the Iowa Workforce Development, there's a program called the Senior Community Service Employment Program, and they do partner with several pantries across the state to support volunteers, and they are able to help and do tasks in the pantries, prepare meals, or assist. So that is an option if you are interested. We can get you connected. They're all available to support in Iowa's 99 counties, or I think it's maybe like 98. There might be 2 counties that they're not available to support in. And then there is the Retired Senior Volunteer Program that can assist as well. So if you are interested in looking for solutions, we can assist you in getting connected to those programs.
Definitely.
Yeah, that
Thank you,
reminds
Kyra.
me of, we have a gentleman that actually was receiving meals from us and was part of a community, a apartment complex for older adults, and he was passionate about wanting to volunteer. And so now we have about 30 people that we serve in this apartment complex, and he leads the charge in making sure everything gets delivered. We have a drop off there, and then he has him and his little team that he's gotten together within the complex. They do the distribution and check on people for us, and it's been a really great way to empower them and give them some purpose in their, because that's just as important too, right? That people have purpose in their second half of life as well.
Wonderful. Thank you. So the panel's already talked a little bit about choice and flexibility, but I think we'd love to hear from everyone here. How does your agency offer choice and flexibility to your neighbors? It says families shop for their own food. Oh, great. Thank you. Yeah, it was a little hard to hear, but I think I heard a little bit about having some flexibility and being able to take smaller quantities of food that are more manageable to carry if that's what someone needs to do. But I also thought I heard something about some unique partnerships where they can, it's okay to go down and use the microwave at the come and go if that's what, Yeah, if that's what's in order. So I think those partnerships are really critical and something else that we certainly want to touch on today. And it actually kind of takes us right into our next topic. So thank you. Perfect. What are some innovative partnerships that help your agency reach more older adults? I think maybe as we're waiting for those answers to come in, we could invite the panel to share a little bit about some of the partnerships that you've found to be most helpful. Joy?
So I think we are really proud of our partnership with Lutheran Services in Iowa. They have a Pathway to Citizenship program, so it is all senior refugees who are working towards their citizenship, and we have started hosting their English classes at one of our community centers twice a week to try to establish that as a place where even after they're done with their classes, after they've gotten their citizenship, they can still come back and not lose that group of friends that they've made and continue to come back. I think starting in July, we're really excited. Heather and I will be partnering together for food for the congregate meal sites and really looking at how we can diversify menus and meals to appeal to a greater group of people. With our food pantries, working to, again, provide food through DMARC to appeal to a very large group of people. And sometimes that's just a matter of asking. If you have a group of individuals who's coming and is looking for a particular item or groups of items, it's not something that we have historically had, but we have had great success in saying, hey, we have this group of people who would really like to be able to access these food items, and been able to bring those in, especially across Polk County, where we see that there are different ethnic groups in different areas, and so we can sort of tailor food for those individuals.
Yeah, something that is becoming kind of is starting to happen in other parts of the country is that where there's higher populations of different ethnicity groups, is that they're starting to create some Meals on Wheels items that match those cultural needs. And so that's one thing that we are very excited. We have a new campus that we'll be moving into come November that will allow us to triple our capacity and have more capacity to maybe partner. Some of the models that I've seen in the country is that you partner with, like, say, for instance, there's a Vietnamese population. You partner with a well-known Vietnamese local restaurant to help do some menu development, and then on top of that, you're gaining the trust for if they know the partnership. The communities are small, and we all know when you feel safe and there's you're connected to those communities, access becomes wider to those communities. And so trying to see how we can create smaller menu selections for different populations that are reflective of who we who live in Polk County.
Yeah, and I love that you pointed out the restaurant partnerships, because that's really been a huge part of the way that Iowa's AAAs have been able to connect with a broader group of older adults is through the appeal of those restaurant partnerships and the opportunity to provide some more culturally specific, culturally appropriate meals. And I know a lot of that work is happening in the Food Pantry Network too. So we're excited to see that. Also see lots of partnerships around volunteers and word of mouth, and the community at large, and even some pantries that offer their own community meal that people are able to enjoy. Offering food is a great way to get people in the door, right? So that's wonderful to see. So I think we're pretty close on time. Right? Okay. So I just wanted to wrap it up, because the other thing that we promised in talking about today's session was that we'd leave you with a few resources. And so the other part of what I do is work nationwide with the Nutrition and Aging Resource Center, and we support Older Americans Act nutrition programs across the nation. And in the course of doing that work, we're able to kind of get a broader sense of what's happening across the country, and also, gather some information that has a lot of, I think, crossover value between our separate networks. And so I invite you to connect with us. We're on, all the popular social media platforms. It's at Aging Nutrition, and I'm happy to provide more information or give you a card where you can connect with us. But you'll see some information about how we can really establish stronger partnerships between that food bank and food pantry network and these Older Americans Act nutrition programs. And that's really an excellent way for us to work together and leverage our already limited resources to make sure that we're targeting those services that we provide to the right people and to the older adults who really need them. A couple of things that also might be helpful. So last year, the Nutrition and Aging Resource Center offered a series on ageism. So this was a webinar series, and the recordings are still available. So again, I'd invite you to get your phone out or connect with me afterwards, and I can provide you with links. So if you think that this information or this training might be something that would be helpful to you or to share with your team, I invite you to check that out. We worked with Iowa State University on developing this webinar series, and there's been it's been really, really popular and really well received. Another resource that I'd like to mention is what's called the Older Adults Equity Collaborative, and so this is really kind of a collection of resources to help programs develop some more cultural competence. One group, for example, that we haven't talked about much today is the LGBTQ plus community. And so in looking through the resources that are available here, there's some great resources on just how to start the conversation about gathering the data about who it is we're serving, and remembering that conversation might be a little bit different when you're having it with an older adult who grew up culturally at a very different time, and how to have those conversations in a really safe and respectful way, and in a way just like everything else that we've been talking about today, that really kind of preserves that sense of dignity and that sense of belonging when people do need to access services. So I'd encourage you to check that out. And then upcoming, this summer's webinar series is on evaluation. Placing the value in evaluation is our next upcoming webinar. That's on June 9th. And so, if you're struggling to measure the impact of what you do or looking for new ways to demonstrate the impact of what you do to stakeholders, this might be something that's of interest too. And you can find all of this on the Nutrition and Aging Resource Center website. So, please, yeah.
I think that you guys have a great opportunity to do something for grandparents in our nation right now. I feel that there's a huge crisis right now in our nation of grandparents that are parenting children, of parents that are using meth. So one of the classes that you guys should be offering, I think, is teaching these people, older adults, how to lobby and how to speak to our politicians and get more funding and more support and more resources for all these grandparents. Because I know here from Fort Dodge, and it is at a crisis level of how many elderly people that we are seeing parenting the children of meth users. And now it's fentanyl as well. So I just wanted to have that because I feel that that's something that's like the elephant in the room that we're not talking about.
No, that's definitely huge. That's valuable, and I'm glad you brought it up. Certainly, caregiving, whether it's, with grandchildren, that a grandparent finds themselves raising, or any other loved one, places a huge strain on people emotionally, physically, economically, in every way, really. And so, I think, and I'd love to hear from the panel too, I think making sure that those people are connected with the resources that are available to them and trying to find ways to deliver those resources in a really flexible way. So again, like something like a restaurant partnership where, people can go to a restaurant at any time of day. So even if they're caring for a child and, they can, in some cases, take that meal with them, and that's okay. And some of our AAAs will allow that. And so I think we're always looking for ways, certainly to help better meet those needs. All of our AAAs also offer classes in, managing some of that stress, managing the financial component, certainly all of those other factors that go into it. But yeah, I'd love to hear from the panel.
So I think we see that on a lot of different levels, not just necessarily for parents or for parents that are drug affected, but for just parents that are absent in general. And we are lucky in Community, Family, and Youth Services that we provide all of the social services for Polk County. So within our own department, we are lucky that we can make those connections for those individuals in terms of seeing the people in our senior centers who maybe were attending and then all of a sudden we don't see them anymore, our staff reaching out to them. So if we haven't seen somebody who has been there for a long time or we don't know why they're not there, we're going to give somebody a call, right? And just check, make sure that they're okay. But also making sure that we educate our staff so they know how to make good referrals and give good information to those individuals to be able to access the supports that they need.
Polk County, if you're not in Polk County, accessing those services through the Area Agency on Aging. So that's a big part of that information and assistance service that we talked about at the beginning, and helping people to really kind of figure out how to navigate some of that. Their Area Agency on Aging can be a great resource. Okay, so I think we're going to skip this last piece, but certainly if you need any help locating data or resources, other resources, as I said, my contact information is right there. And so I encourage you to reach out to me, because something else that we're doing as we work to strengthen our partnerships across this entire network is developing kind of a partnership guide that kind of helps us navigate how this can work. And so if you have some great partnerships or something you've found that works, or even a big challenge, I would love to hear from you, because we'd love to include that in that partnership guide, and that's something, of course, that we would then, once it's developed, be able to share both with the area agencies on aging, the nutrition services providers, and then also with all of our food bank and food pantry partners. So with that, I thank you so much for your participation today. I know we got off to a little bit of a rough start, but I really appreciate our panel being here and offering their expertise to today's conversation too. So thank you so much.